Did you know that pancreatic cancer is often called the silent killer because it's usually diagnosed at an advanced stage? Today we're going to uncover the 10 early signs of pancreatic cancer that you should never ignore. Early detection can make a significant difference. So stay tuned to learn more about these crucial warning signs. Symptom 1. Jaundice. Let's start with jaundice, one of the most common early signs of pancreatic cancer. Jaundice is characterized by a yellowing of the skin and eyes due to an excess of bilirubin in the blood. When a tumor blocks the bile duct, bile can't reach the intestines and accumulates in the bloodstream, leading to jaundice. Along with the yellowing of the skin and eyes, you might notice dark urine, pale stools, and itchy skin. Research from the National Cancer Institute indicates that jaundice is often one of the first signs of pancreatic cancer, especially if the tumor is located in the head of the pancreas, where it's more likely to block the bile duct. If you notice this symptom along with others mentioned in this video, it's crucial to see a doctor immediately, as early intervention can significantly improve outcomes. Symptom 2. Abdominal pain. Next, we have abdominal pain. Pancreatic cancer often causes a dull ache in the upper abdomen, which can radiate to the back. This pain is often worse when lying down and better when sitting forward. It can be persistent and gradually worsen over time. The pain is caused by the tumor pressing on nearby organs and nerves. A study published in the American Journal of Gastroenterology found that 70% of pancreatic cancer patients reported abdominal pain as one of their initial symptoms. This pain can often be mistaken for other, less severe conditions, making it vital to pay attention to persistent or worsening pain. Symptom 3. Unexplained weight loss. Unexplained weight loss is another red flag. Rapid and unintentional weight loss can be a sign that your body isn't absorbing nutrients properly, a common issue in pancreatic cancer. As the cancer grows, it can interfere with the pancreas's ability to produce enzymes necessary for digestion, leading to malabsorption of nutrients and weight loss. Additionally, the cancer itself can increase the body's energy expenditure, contributing to weight loss. Research from the Journal of Clinical Oncology shows that significant, unexplained weight loss is a common symptom in about 80% of pancreatic cancer cases at the time of diagnosis. If you experience sudden weight loss without trying, it's important to consult with a healthcare provider. Symptom 4. Loss of appetite. Hand in hand with weight loss is a loss of appetite. Pancreatic cancer can lead to a decreased desire to eat, sometimes resulting in early satiety, where you feel full after eating only a small amount of food. This loss of appetite can be due to the cancer's effect on metabolism or its impact on the digestive system. It can also be a result of the body's overall response to the cancer, causing general malaise and decreased interest in food. A study in the British Journal of Cancer reported that loss of appetite was a significant symptom in many pancreatic cancer patients, often occurring in conjunction with other symptoms like weight loss and fatigue. Symptom 5. Nausea and vomiting. Nausea and vomiting are also common early signs. As the tumor grows, it can block parts of the digestive tract, causing food to remain in the stomach longer and leading to nausea and vomiting. This blockage can be partial or complete, and the symptoms can vary in intensity. It's not uncommon for these symptoms to be mistaken for gastrointestinal issues, delaying the correct diagnosis. According to the Journal of Gastrointestinal Cancer, these symptoms are often present in the early stages of pancreatic cancer, highlighting the importance of further investigation if they persist. Symptom 6. Changes in stool. Changes in stool such as steatorrhea, fatty stools, or pale stools can also indicate pancreatic cancer. Steatorrhea is characterized by bulky, foul-smelling stools that float due to the high fat content. This occurs because the pancreas is not releasing enough digestive enzymes to break down fat. Pale stools, on the other hand, can be a result of a blocked bile duct, preventing bile from reaching the intestines to help digest food. A study published in the World Journal of Gastroenterology found that changes in stool were reported by a significant number of pancreatic cancer patients, making it an important symptom to watch for. Symptom 7. New-onset diabetes. A new diagnosis of diabetes, especially in someone with no family history or risk factors, can be an early sign of pancreatic cancer. The pancreas plays a crucial role in regulating blood sugar by producing insulin. When a tumor affects the insulin-producing cells of the pancreas, it can lead to diabetes. This new onset of diabetes is often sudden and can be difficult to manage with standard treatments. Research in the journal Diabetes Care indicates that about 1 in 5 people with pancreatic cancer were diagnosed with diabetes in the months leading up to their cancer diagnosis. If you've recently been diagnosed with diabetes and have other symptoms on this list, it's important to discuss them with your doctor. Early detection of pancreatic cancer can significantly improve treatment outcomes. Symptom 8. Blood clots. Blood clots can be another warning sign. Pancreatic cancer can cause abnormal blood clotting, leading to deep vein thrombosis, DVT, or pulmonary embolism. Symptoms of DVT include pain, swelling, and redness in the leg. while a pulmonary embolism can cause shortness of breath, chest pain, and coughing up blood. These blood clots occur because cancer increases the production of clotting factors in the blood. A study published in the journal Thrombosis Research found that patients with pancreatic cancer are at a significantly higher risk of developing blood clots, often before the cancer is diagnosed. Blood clots can be life-threatening and require immediate medical attention. If you experience any symptoms of DVT or pulmonary embolism, it's crucial to seek medical help right away. Recognizing these signs and understanding their potential link to pancreatic cancer can aid in early detection and potentially save lives. Symptom 9. Fatigue. Fatigue is another common early sign of pancreatic cancer. This isn't just the usual tiredness you feel after a long day. It's a profound, overwhelming fatigue that doesn't improve with rest. Fatigue in pancreatic cancer can be caused by several factors, including the body's response to the cancer, anemia, nutritional deficiencies due to malabsorption, and the general stress of dealing with a chronic illness. A study in the journal Cancer found that fatigue was one of the most frequently reported symptoms among pancreatic cancer patients, often occurring early in the disease. Fatigue can significantly impact your quality of life, making it difficult to perform daily activities. If you're experiencing persistent, unexplained fatigue along with other symptoms mentioned in this video, it's important to consult with a healthcare provider. Symptom 10. Depression and mood changes. Depression and mood changes can also be early indicators of pancreatic cancer. Interestingly, many patients report experiencing depression and anxiety before being diagnosed with pancreatic cancer, even without a prior history of mental health issues. These mood changes are believed to be linked to the body's response to the cancer and the biochemical changes it induces. It's not uncommon for patients to feel a sense of impending doom or have unexplained mood swings. Research published in the journal Palliative and Supportive Care highlights that mental health changes can precede the physical symptoms of pancreatic cancer, making them crucial for early detection. If you or someone you know is experiencing significant changes in mood or behavior, particularly if accompanied by other symptoms like weight loss or abdominal pain, it's important to seek medical advice. Mental health symptoms should never be ignored, as they can be an early warning sign of serious underlying conditions. So there you have it, the 10 early signs of pancreatic cancer that you should never ignore. Remember, early detection is key. If you or a loved one are experiencing any of these symptoms, it's crucial to seek medical evaluation as soon as possible. Let's recap the signs. 1. Jaundice. 2. Abdominal pain. 3. Unexplained weight loss. 4. Loss of appetite. 5. Nausea and vomiting. 6. Changes in stool. 7. New-onset diabetes. 8. Blood clots. 9. Fatigue. 10. Depression and mood changes. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Awareness can make a huge difference. Also, don't forget to subscribe to our channel and hit the notification bell so you never miss out on our informative videos. Stay informed, stay healthy, and take care of yourself and your loved ones. Thank you for watching, and see you in the next video.